V and Virginia. This is my final head-to-toe assessment. And this is my patient Brandon, and he's going to be assisting me today. So first, we'll go ahead and begin. So first I'm going to walk in, and I'm like, hey Brandon, my name is V. I'll be your nurse. I'm going to wash my hands, make sure all of that's done good. So you're here for your annual checkup, correct? So, okay. So what that entails is it entails a head-to-toe assessment. And so what I'll do is I'll be touching you, looking at you, listening to you, palpating you, and all that good stuff. But I will explain as I'm going through everything. If you have any questions, just stop me. If you're confused with anything or whatever, just, feel free to please stop me, okay?
Okay.
And so we'll go ahead and begin our assessment. I'm going to go ahead and put this part of the bed up if you want to go ahead and lay back for me and sit back. Okay. So you have no medical history, any previous surgeries, any kind of problems or anything. I see your blood pressure was well. I have, let's see, a blood pressure 122/79. Your heart rate was 78. 18 respirations, afebrile 97.1, and your O2 sat's 100. So that's just perfect. So that's good. You seem like you're a healthy adult, and we'll go ahead and confirm that with the assessment. Okay, so what is your name?
Brandon.
Okay, and how old are you?
22.
Do you know today's date?
Today is March 20th now.
Okay. What year?
2014.
And why are you here?
Just for my general checkup.
Good. Okay, so you are awake, alert, oriented ×3. And you look to be well groomed. Your speech is clear and everything. So I'm going to start off by first just my general assessment. And I'm going to feel on your head, and I see that your hair is evenly distributed. There's no lumps or bumps. I don't see any lesions, no dandruff, pretty clean. Everything seems symmetrical. And I'm going to take a look at your eyes. Okay.
Okay.
So if you can, just look straight ahead for me. I'm just checking for pupil reflexes. I'm sorry, I know it's kind of bright.
Yeah.
Good. And both of those react and respond appropriately, so that's good. So what I want you to do is I want you to follow my pen light, but don't move your head, okay? Only your eyes only.
Sorry, my eyes are kind of watering.
That's okay, I'm sorry. Okay, good. Okay, cover one eye for me. And I want you to tell me when, and I'm going to cover one of mine, when you can see my hand, okay? And just say now.
Now.
Okay, and then cover your other side. How about now? Good. Okay, and down here you can see well?
Yeah.
Okay, good. All right, and just go ahead and just look straight ahead for me, and I'm just going to go close. Good. Good job. Okay. And now I'm going to take a look into your ear. And with an adult, you just want to pull up a little bit and back. And his eardrum is intact. There is no obstruction right there, no full of wax or anything like that. A little bit of hair, which is good. And then I would do the same thing with the other side. While I'm here, I'm going to go ahead and look in your nose. Okay, good. All right. Now you're going to feel me palpate on your sinuses. Do you have any pain, tenderness, or anything like that? No? Okay. And right here. And also down to your joint and everything. Can you open for me? Okay. Let me just take a look. Stick out your tongue for me and say, ah. Good. So your uvula has good gag reflex, so that's awesome. Your eyes, okay. I'm going to pull down. I'm just going to look. Okay, good. Can you squeeze both closed? Good. Now can you open? Good. Okay. And then yeah, well good. Smile, good. Okay, can you open? And no pain in the joint? Okay, no TMJ or anything like that. Move your tongue side to side. Wonderful. And all your teeth are intact, so that's good. Okay, I'm going to feel on your lymph nodes. No pain, tenderness, or anything like that?
No.
Okay, good. gonna feel on each side. One side at a time, your carotid. And that has a good rate, which is right at, well, I'd have to count for a full minute, but it would be about the 78 that you had came, your initial assessment vitals. Good. And I can also listen. One side at a time, always. I'm gonna just take this off, but I'm actually listening. Okay, good. Okay, can you shrug your shoulders for me? Good, all right. No pain or anything like that down here? Okay. All right, and same thing. I'm just gonna be feeling, and then I'm gonna be taking a listen. But go ahead and sit up for me if you don't mind. There you go, and just hang your legs over. Okay, now take a deep breath for me. Good, so you have good symmetrical inspiration, expansion of the chest, which is good. I see that your spine is aligned correctly, which isn't any indicative of scoliosis, lordosis, or kyphosis, which is good. Your shoulder's good. Your A and P ratio is 1 to 2, which is anteriorly right here is 1 to 2 times as wide posterior on your back, so that is good. I did not hear any bruise or anything like that whenever I was listening to you. But while I have you sitting up like this, I'm going to just go ahead and listen to you. And I would have my stethoscope in my ears, obviously, but I'm just doing this for video purposes. Okay. And just breathe normal for me. You don't have to take a deep breath or anything. I hear good air movement on inspiration and expiration. Okay, you want to go ahead and lay back for me again? And I'm also going to continue my assessment listening to you here.
Okay.
Okay. And I don't hear any kind of, no croupy, air is moving great. It's effective. Okay, I'm also going to listen right here at your trachea, which is midline to your sternal, suprasternal notch, normal fremitus, no crepitus or anything like that. Okay, I can hear bronchial, bronchiovascular, and vascular sounds, good, with no rhonchi or crackles. Awesome. Now while I'm also here, I'm going to go ahead and do your heart as well, and so I'm going to just take a listen to your heart, okay? And that's a regular rate. Right here at the apical pulse, the maximum impulse, go ahead and turn for me to this side, to the left. There you go, while I'm listening for that valve to close. Okay, and I do hear it. Okay, go ahead and lay back for me. Okay, wonderful. And I see everything is audible. Your trachea is midline. Now, whenever I'm palpating or anything, do you have any pain? Okay, what about any of this? No? Good. Okay, so your diaphragm, it seems like, you're not using any accessory muscles or anything like that. when I am listening to your apical pulse right at the mid-clavicular line, lateral to it, about the 4th, 5th intercostal space, that's where your apical pulse is. And so I'm able to listen to that, and I don't hear any bruits or heart murmurs or anything like that, so that's good. So now I'm just going to lightly percuss over these areas. And you want to be able to hear like a dull sound, which is good. And I'm also noting your skin color. It's warm, dry, it's intact. Your capillary refills, definitely less than 3 seconds, and that's bilaterally, which is good. Okay, you want to go ahead and squeeze both my hands? Okay, good. Your strength is equal. You're able to move. Can you bend both arms up? Now straighten for me. Can you move out? And then back in. Good. So no problems with range of motion or anything like that. Also, while I'll go down here, we'll look at his abdominal assessment. And normally the gown, he'd be in a gown, draped and covered for privacy and everything. And I'd be inspecting, and he doesn't have any kind of bruises, discoloration, or anything like that. It seems soft, not tender, anything like that. And that is all before I do my actual auscultation, because I want to look at him first just by sight. And then the first thing I'll do is I will auscultate, because I don't want to palpate or anything, therefore giving some bowel sounds that were prematurely done or inaccurately so. So now that I was able to look and everything, now I'm going to listen to all 4 quadrants. So your bowels have been okay? Good. When's the last time you had one? You said this morning?
Yes.
Okay, good. And so you've had no problems with that or anything. And you want to listen to all 4 quadrants, you know, and I do hear hyperactive, well, I hear active vowel sounds in each 4 quadrant. But if I want to make sure to let you know that if I did not hear any kind of vowel sounds, that I would listen at each quadrant for no less than 5 minutes, because hypoactive vowel sounds can be heard at like 2 minutes, sometimes even 3 minutes apart, so for a whole 5 minutes, okay? Also, while I'm here, I'm looking at your abdominal aorta, and I'm going to go ahead and listen at that. And your umbilicus is in the right spot. It's concaved as it should be. No abnormalities. Also, I'm going to listen to your iliac vessel, as well as the femoral. I'm also palpating right here on your bladder, so you don't have any pain, no tenderness or anything like that. You're urinating fine. It's been all good. Okay, good. Now, whenever I'm going to percuss, you don't have any pain or anything like this? Okay, good. Okay, I'm percussing, I'm palpating lightly right here. But if I were to do like a deep palpation, do you have any pain? I'm sorry. No pain.
Okay. I mean, you can feel it
Yeah.
deep, it's just...
Yeah, I didn't mean to tickle you, right? Okay, and then I can also percuss, which is this. And you want to be able to hear like a dull sound where his spleen is, as well as on his right upper quad. I want to percuss right here, and you want to feel that deep thump, because that is where his liver is.